After spending a couple of days in Ottawa last week, Canada's premiers reconvened this afternoon to once again talk healthcare. It was their first meeting since the federal government put a new funding agreement on the table. So what did they decide? Let's bring in Heather Stefanson, Premier of Manitoba and the Chair of the Council of the Federation. Premier Stefanson, thanks for joining us.
Great to be here with you, David.
I'm wondering what you can tell us about how today's discussion went with your provincial and territorial colleagues. Are you going to accept this deal, or are we in store for some more federal-provincial fighting?
Look, we had a very good meeting today. We are very much united on our front that we will be accepting the money from the federal government, but also recognizing that this does not represent what is a long-term funding need for our healthcare systems across the country. So we will be writing the Prime Minister to address some of the challenges associated with individual things within the agreement.
Okay, I want to start with that first part, that you will be accepting the money. I mean, I know it's not everything you wanted, but it is billions of extra dollars across the country, which is hard to reject in any capacity. So does this mean you're not going to try to reopen conversations with the Prime Minister to extend the term and increase the dollar amount? You've accepted this is it, and you're going to move on to your bilateral agreements?
We've accepted this for now, but we will move on to the bilateral agreements. But we do recognize that this is not a long-term solution to the healthcare funding that is needed within our country. And this is by no means a panacea to fixing healthcare across the country. So it's a step in the right direction. We recognize that, and we'll be moving forward from here. Okay,
you say it's not a long-term solution, but it is a 10-year financial commitment of $196.1 billion. I mean, does it need to go beyond 10 years before you to consider this a long-term solution? What are you looking for in terms of length then?
No, I think it's significantly less than what we had originally indicated was needed to address the long-term financial challenges within our healthcare system. But we recognize that this is a step in the right direction, and so we've agreed to move forward and accept that federal funding for now. Again, there are some challenges with respect to the bilat, what happens at the end of the 10-year agreement. We're concerned about the fiscal cliff that could be as a result of that. There's existing bilateral agreements within healthcare out there where we're concerned about what does it mean in terms of the potential fiscal cliff of those monies falling off. And so there's still a number of issues that we want to be addressed. So we will be writing a letter to the Prime Minister from all of us to address some of those challenges.
Okay, you talk about a fiscal cliff, but presumably the money that the Prime Minister laid out in this 10-year plan, that gets baked into the base every year in terms of what the transfer would be to the provinces. Is that not your understanding?
No, that's not our understanding right now, and we're very, very concerned about that. What happens at the end of those 10 years? We know that the end of these bilats, often the federal money stops, and that creates a fiscal cliff in terms of the programming. And so we want to ensure that that is baked into the bottom line moving forward. Okay,
so I just want to be a little bit granular, if I can, for a second, because this offer from the federal government is kind of broken into two parts: the Canada Health Transfer increase across the board and the bilats. Are you saying the fiscal cliff is in the one-on-one deals with the provinces or in the whole package? Because the Canada Health Transfer component, as I understand it, is a permanent increase in the base.
It's not actually a permanent increase in the base at all. It's just $2 billion up front, and if it was built in the base, it would be $2 billion per year. So it's just $2 billion, again, significantly less than what we need to see to help the funding challenges within our healthcare system. So there is a challenge with that, but there's also a challenge with respect to the bilateral agreements, which end after 10 years, as we understand it.
Right, so I can understand the concerns you might have with the bilateral agreements, but the Canada Health Transfer, according to the documents I've read from the federal government, there's a 5% floor guarantee in each of the next 5 years, and then it would revert back to the 3% or the nominal GDP growth percentage, whichever is higher. Is that how you understand this plan to go?
So what we were looking for is $28 billion to go in the baseline funding. So that's $28 billion per year. The $2 billion is not even in the base funding. So that would have been $2 billion a year for the lifetime moving forward, but that is not baked into this. And so we do have concerns about that. It's just the one-time funding that, yes, will escalate based on the escalators. But again, the escalators is, it has a base of around 3% right now. So the difference between that 3.5% and 5% is the only increase that we're actually receiving over the course of the next couple of years. And then after that, there's no guarantee after the 5 years. And so there are some challenges around that, there's no question, but this is not $2 billion to the baseline funding of the Canada Health Transfer.
Right. The initial $2 billion you're talking about is sort of the one-time immediate infusion of cash that they're promising to give you in this fiscal year to deal with the wait.
It's one time.
It's one time. No, I get that. Okay, but back to your fiscal cliff and the long-term concerns. This is a 10-year, the bilaterals will be 10-year agreements, and then the other component also runs for 10 years. How could the Prime Minister of 2023, no matter who it was, commit to something beyond 2033? I mean, normal planning and funding cycles going out a decade seems like they've already stretched kind of far. I mean, would you make a commitment now for 2033 with a municipality or another organization in Manitoba?
Well, again, if they put it into the baseline funding now, which is what we've been asking for, then that would be ongoing and recurring over the course of the lifetime of the agreement. And so, right now, what the challenge is after 10 years, and 10 years can go by pretty quickly, I can tell you, and after 10 years, what happens to those investments that need to be continued on the programming that those investments are investing in? What happens to those programs at the end of those 10 years? If there isn't the extension of those agreements in any way, then that's what we call the fiscal cliff, that's what happens at the end of that time frame.
But is that a conversation for right now when you're trying to deal with these urgent reforms and staff recruitment to the system, or is that a conversation for 5 years from now when you're sort of in the middle of this and closer to the end of that planning horizon to figure out what next steps will be? Because you don't know what the needs of the health system will be in 2033 compared to right now.
I think it's a discussion to have now and 5 years from now, to be frank with you. And I think it is something that we need to have those continued discussions. Exactly what you're saying is that things can change over the course of time, and we need to make sure that we have flexibility within our healthcare systems. But really what we need is the sustainability of long-term financing for the Canada Health Transfer, for the funding of healthcare across our country. This is not that agreement today, and that's why we want to make sure that some of those challenges are addressed in the long term. For right now, this is $46 billion into our healthcare systems across the country. It's more than we had before, so certainly we're willing to accept that.
So what are your next steps, just as a final point? You say you've written a letter, you're going to write a letter to the Prime Minister to talk about this long-term sustainability. Is this something First Ministers need to meet on, or do officials do this?
No, so what we will do, obviously, after this, we are accepting the financing from the federal government. So after this, we will sit down as individual provinces and territories and negotiate and have discussions over those bilateral agreements moving forward. But I think what is also, it has to be on the table, is some of the concerns that we have with respect to the long-term financing and sustainable financing of our healthcare system. This doesn't necessarily deal with that, so we need to continue to have that dialogue with them as well. So whether it's a review after 5 years or what that may look like, those are some of the things that we will address in a letter to the Prime Minister and have future discussions, we hope, at that FPT table.
Okay.
Or, sorry, the FMM table.
Right, the FMM table. All right, Premier Stefanson, thank you so much for your time today.
Thanks, David.
Okay, so how soon, how quickly could these bilateral deals be reached? Tim Houston is the Premier of Nova Scotia. Premier Houston, welcome to the show.
Happy to be here. Thanks for having me.
I wonder if you could build on the news we just got from Premier Stefanson, that premiers have collectively agreed to take the money from the federal government and move on to focus on the bilateral agreements. How did Nova Scotia get to the position that you're comfortable doing this?
Yeah, thanks for that. And we've certainly been very focused on healthcare in this province, fixing healthcare, my number one priority. paying for the fixing, that, that's those are my two focuses: fixing it and paying for it. So look, the federal government put some new money on the table. Of course, I would always push for more for Nova Scotia, but we know the reality is that the money that's there is there. So no point in dragging the feet. We're just interested in moving forward and getting on with making the investments in healthcare that will make healthcare more accessible for Nova Scotians and for Canadians. So time to move forward. We want a partner in Ottawa. They have a partner in Nova Scotia. It's all about putting access before anything else.
Okay, Premier Stefanson raised some concerns about what she's calling the fiscal cliff, that the bilateral agreements end after 10 years, and she has some concerns about the other funding after 10 years. Can you realistically expect arrangements that run more than a decade out from the federal government when it comes to really anything, let alone health?
Yeah, I think, look, everyone, we're going to make funding investments now. We're going to make commitments to Nova Scotians, to Canadians on those investments. So nobody wants to think about a situation where you got to go backwards or unwind maybe some of the care that's being provided. So I think it's realistic to have agreements between the levels of government that they'll continue to monitor it. They'll look at it and make sure that at that point in time, we're making the best decisions for Nova Scotians and for Canadians. So we don't want to see that drop off, and I'm sure the federal government doesn't want to see that either. So the best we can do is agree that we don't want that drop off. Nobody wants that drop off, and when the time comes, we'll have to address that. But for today, the investments, the new money coming to Nova Scotia, our share is about almost $150 million. We won't have any trouble investing that in the healthcare system. The needs are very significant, and that's where our focus is.
Okay, you've had a busy day because you just had the call with the other premiers, and you've also met with Ministers LeBlanc and Minister Duclos from the federal government who've been on the East Coast today. How would you characterize that meeting in terms of where you are on moving ahead with your bilateral agreements with the federal government?
Productive. I would say they're productive. So I had my health minister, Michelle Thompson, with me, and our whole health team, senior officials, deputy ministers, and as did the federal government. So look, everybody wants to move forward. As I say, we wish it was, we can always want for more and push for more, but we know the realities and the priorities we're aligned on. This is about access to healthcare. This is about accepting the challenges around staffing, around human resources, around technology. So all of these things are really critical to getting us past the crisis we're in here now. So the federal government put some money on the table. We want to work with them to make sure that goes to the proper investments to support improving healthcare, and there's no time to waste. So we're just getting on with it. We're moving forward.
I saw a news release from your neighbor next door in Newfoundland and Labrador, Premier Andrew Furey, who said that he and his officials are immediately moving to negotiations on the bilateral agreements. Is that where Nova Scotia is? Are you on the by the federal budget timeline?
Yeah, immediate. And we had some of those discussions today about what those, how we would deploy those investments. So I would say it's not even really a question of immediately moving to them. I think we're already there, and that's what Nova Scotians expect. So they want me to move quickly. I feel a sense of urgency. I kind of push that sense of urgency down through the healthcare system. Everyone working on the front lines of healthcare, I want them to know that we feel the urgency. We have to support them. We need to recruit to support them. We need to retain them. So there's a lot of work to do. I think good things are happening too. Sometimes we focus on a lot of the negative stories, but I'm also starting to hear good stories, good positive interactions with the healthcare system, and that's important too. So there's a lot of work to do, but our sleeves are rolled up, and we are actively working as aggressively as we can.
Premier Scott Moe of Saskatchewan said today that the volume of money, the quantum that was put on the table, isn't enough to make sort of big transformative change in the healthcare system. You mentioned the negative stories. We've heard about the challenges in your emergency room, people who died waiting for care and other things. How does this money allow you to attack those challenges, and what kind of solutions does it buy for you?
Yeah, so Nova Scotia, we put out our Action for Healthcare plan. We put that out back, quite a number of months ago. It was the first real plan for healthcare in this province, and certainly well over a decade. So the plan is there. So what this new money allows us to do is kind of speed some things up. Where there's a lot of changes happening. There's a lot of, positive incremental changes happening. But now with some additional money, we can speed things up and get to things faster that we would have, maybe we're a little further down the timeline. So
what kind of things,
we hear the voices of those in the front lines. We listen to them, certainly in the emergency room situations. We acted very quickly to add patient advocates in the room to support advanced care paramedics, nurses. We're looking at the scope of practice. So things are happening. But as I said, we know, look, we're under no illusions about it. There's a lot of work to be done. I may have inherited a broken healthcare system, but I will give every ounce of energy I have to fix it, and that's my focus.
What kind of things can you get earlier? You said things you can accelerate and move up. Are there specific things? Because I know everyone has a shortage of doctors and nurses, but there's not like there's this giant pool of unemployed doctors and nurses, right, that everyone can dip into. So what do you move up to the front of the line now?
Yeah, certainly. Being some common sense around credentialing, making sure that we're accepting of credentials from other jurisdictions. We can never sacrifice the standard of care, but we'll have to have some common sense about the experiences people have and the credentials they have, certainly across the country, but internationally as well. So working with immigration, investments in technology, investments. We've invested in this province in a number of transport drivers to move people around from appointments from hospital to hospital, which were normally, they'd been done by advanced care paramedics, but with the new system, that frees up these paramedics to go and respond to 911 calls. So those types of investments, and they're investments and they're significant. But now we can start to move faster. Maybe in that case, more transport drivers. Maybe more on the recruiting front. But certainly, investments in technology, that's a no-brainer. We can really make significant investments in technology to help improve the efficiency, to support those working in the system. But now we can move a bit faster on some of those things. So we know what needs to be done, and our priorities are aligned with the federal government because they're the priorities of Canadians. So we're not worried about the strings attached. We're not worried about the accountability. We have a full website. Any Nova Scotian, anyone can go to our website, Action for Healthcare, and see how we're progressing on what we're going to do. So we're accountable. We want to be transparent. We know there's work to be done, but I also want to assure Nova Scotians that the work is being done. Things will start to get better.
Okay, Tim Houston, thank you so much for your time.
Thanks for having me.